If you're just joining us, I'm here with Lieutenant Governor Josh Green, who is in his regular duty over there, but taking the time to answer our questions about what's happening with COVID-19. So give us an update. I know you have the latest numbers, so let's start with that.
Thank you. 2 cases today, taking us to 675. Everything else was stable. No fatalities were reported to me, and our ventilators are being used at 11% rate. Hospitals beds are free. So basically, we're very good, though it was disconcerting to have 9 the previous day. So we're in kind of a transition time where we saw a little burst of activity from the holiday, from Memorial Day. And to be frank, I think we might be chatting next week this time with another burst because of the protest and what I think is, I very much respect, peaceful protest. But if people don't socially distance in an age of COVID, we could see cases.
Yeah. Okay. So before we get to that, I did want to talk to you about the 9 cases from yesterday. That was a shock to a lot of people because we had gotten used to this 1, 2, 0 cases. What can you attribute that to? You kind of said it. Is it really Memorial Day weekend?
Yeah. Memorial Day weekend and the end of the year parties that were associated with graduations, though we kind of had a rule against them, but it's human nature to get together and celebrate great moments. So obviously we had a little spike. You're always going to get a little surge about 7 to 10 days, maybe as late as 14 days after events like that. So we'll see the same thing after the protests to honor, Mr. Floyd. So I think that is the new normal. We'll see little bumps here and there. Also, of course, we're going to have a bump after we open up inter-island travel that'll be small. And the bigger question will be when we open to to mainland travel.
Yeah, the big concern too is that we saw a cluster, I guess, of these in nursing homes, and we did see some in Kalihi Valley homes. So yes. Are we starting to see a trend with where these instances are popping up?
I think for me, anyway, it's a little too soon to say it's a trend, but it is a concern. I really, of all cases that I worry the most about, it's those that are associated with nursing homes, because I'll show you, I'm standing in front of a nursing home right now. My ER is attached to a nursing home, and so we're a nursing home in the ER. We're super careful to not have one of the circumstances in which even a small number of cases could have a really terrible impact.
Yeah, remind us where you are exactly.
Yeah, I'm at Kohala Hospital on Big Island, where I work as a doctor to mix it up a little bit, keep my brain limber.
Yeah, definitely. And I know we talk about just kind of the vulnerable population, and we talked about these big gatherings, especially the protests this past weekend. A lot of people concerned about no social distancing. I was there covering this, and while a lot of them were young, there were families. There were some seniors there. So yes. How concerning is this?
It's concerning because, again, fantastic job people did with peaceful protests, nonviolent protests, but Hawaii has twice the national average of multi-generational families living together. And also, because of the concept of ohana, when we go protest, we sometimes go protest with like 2 and 3 generations. So if we see spread between our, the middle-aged generation and then our kupuna, it could be bad. Their mortality rate's much higher. So we have to be super careful as we go forward. Make sure people take a mask, and no matter what we're doing in large gatherings, wear the mask. That's really important until we come way down the other side of the mountain on COVID.
Yeah, and the other thing too is we've seen these protests also across the country, and if we're starting to open, again, it's a ripple effect, right? I mean, we're not talking yet about mainland travel, but inter-island travel, a lot of people say these people that protested came from the mainland. So there's that concern.
Right. Well, I sent a special group of friends out that are in law enforcement to go check that out, so that if anyone's breaking the quarantine, again, totally respect nonviolent protest, whether they come from the mainland or from here, but you still had to adhere to the quarantine rules because we don't want to spread COVID-19. And that is something, the governor has tasked me to work very carefully on how we ultimately bring back tourism from the mainland. We're leaning heavily now towards getting the protocols in place to have a test for anyone that comes. And it's a lot of detail work. We're going to try to make it very easy to get done, but I think it's a safe move. And given the circumstances on the mainland now with extra spread, there's still almost 3,000 cases a day in California. I personally polled all of my my groups and clan. 96% of people wanted us to do a test before people came to Hawaii and when we're returning. I know HMSA and those guys also looked at it. 80% of the people, I believe, felt we had to have testing. It just makes sense, right, if it can be done. So we're working on that because there's going to be COVID on the mainland for a while. And at the same time, if we were to wait out the storm all the way through the fall, our economy could not recover. So I'm working very hard to support the governor to make that balance.
And in your observations, at what point would a second wave of cases would require us to shut down again? Could that really happen?
We can't allow it to happen because it would be catastrophic. So there's numbers that get bounced around. I will tell you from a practical standpoint, if we started seeing numbers around 30 every day, that would be really problematic. If we had 30 people daily and that put that much pressure on, bye guys. If that put that much pressure on, some of my patients going home.
Okay.
Yeah. If we saw over 30 patients a day, which would be 900 a month coming into the state, and we had to do all the tracing and tracking and some extra testing, it would begin to create a major problem. So I'm cognizant of that. That's why testing would knock by more than half the number of positive cases we'd have in Hawaii. There's just lots of reasons to do it. We are beefing up our tracing system. As you know, Department of Health is gearing up to have 300 plus tracers, which is extraordinary. And we have lots of volunteers, which is amazing. But we're a little state, right, with only a small healthcare footprint. So we don't have the luxury of having hundreds or thousands of cases. That would be too much for us to contain.
And you mentioned contact tracing. I mean, how much of a nightmare would it be to try to trace things from the protests? I mean, there's just no way. How would you go about even doing that?
Nightmare? Like Freddy Krueger style nightmare. Yeah, Nightmare on Elm Street. Would not be able to do it. Because the very nature of nonviolent protest is people come anonymously and leave anonymously, which is appropriate. You can't do it. So if we get a big outbreak from that kind of protesting, that's the kind of thing that changes the calendar and moves it back a month, which we can't afford that. So I want to say this lovingly to everybody, because I'm a protester at heart. My mom taught me that, but holy cow, if we're going to be out in protests, wear a mask and embrace the COVID prevention while we're embracing nonviolent protest, because there's no way for us to deal with 300, 500, 700 cases in Hawaii. That would necessitate a shutdown again. And man, would that be hard. So
yeah, no one needs that. No one wants that.
No, that's too much. I don't think that's going to happen because we have sufficiently lowered the viral load in our state. It's actually, we're very lucky. Had we already opened the state to tourism and had the large protests at the same time, we would have been up the creek, if you will. But because it happened this way, I think we're okay. I'll be watching the case counts very carefully, and the Department of Health is doing a very good job tracing. Lots of kudos to Dr. Park and Dr. Anderson. It's a huge lift if you suddenly get large events. That's why we're not having conventions now. Think of a protest as a convention on steroids, and everyone's getting together and embracing one another because of the issue. Man, would that be tough. So
yeah, and just having been out there, it just looked like people, it felt like it was pre-COVID when I was out there. And I really was concerning because there was so many, not just young people and seniors, but children. So I think that was really hard for me to see.
Yeah, and we're heading towards a time where we want to open schools again because our kids drive us crazy. They're at home all the time. So, amen,
yeah. Josh.
So that's also got to be a consideration. So lots of things, but again, I totally support protests, and because an African American man was murdered, we have to stand up and protest. I wish I could have been there. I was on call, but I would have been there with a mask, and so please everyone do that. And continue to follow the rules best you can. If you're going to go to the beach because it's beautiful out today, stay 6 feet away from other groups, and do not break the social distancing caveats, because we can continue to keep this totally suppressed. But watch out next Friday, Saturday, Sunday, once people start having the demonstration of transmission, we could have a couple days. I want people to remember we're going to see higher numbers than zero, right? No matter what. Can't stay at zero forever. But if we stay in the single digits, we're great. If we stay in the teens, actually, we're completely fine. But then I'll be increasing the caution if we go much farther.
Yeah, and that would be such a shame, because everyone looking forward to that inter-island travel. I did want to ask you, there was some concern about military families that were coming. I know early on we heard about them not being required to do this 14-day quarantine like everyone else. What's your position on that?
What I did ask the general and others about this, and I was kind of cautious. I wanted to caution them that everyone has to have the same respectful rules. The truth is, they did add a whole nother military layer of rules to keep people from being out and about. Now, everyone needs to be treated the same. I think that's really where we've got to be. And so that discussion was had, and I think that they're going to be respectful of that. One of the challenges for military families is they come in cold and they're setting up their lives. And so, we're obviously we're not recommending beach parties and that kind of thing, but people are out there starting their lives here and being supportive of our country. So they're getting furniture and getting groceries. I think that's where we have to be reasonable and sensible. But the military's aware that we can't have a surge because of military activity coming. So they're going to follow that.
Okay, that's good. I know, because we've gotten some questions in the newsroom about why they're not being required to follow the same protocol that locals are, especially when they're coming from hot spots also. So
yeah, I think they realize, after we all spoke a little bit, that there really should be no exceptions. We have an added respect for people who serve, but we're all in this together. So we can't spread, so everyone's got to lay low.
Okay. Well, at this point, there's no expected action because of the slight uptick, right?
No.
And you're just monitoring right now. In 2 cases today, you said that's a pretty good sign. So I guess just in general, the reminder of social distancing going forward, although people have been upset by all the images that they've been seeing this weekend.
Well, that will serve as a reminder. And remember, now people can go out to restaurants, so do it right. If somebody doesn't set up the tables 6 feet or more apart, make sure you don't sit near them. And go with your clan. Try not to have any dinners with people outside of your group if you can avoid it, and we'll be fine. And we're still in a really great zone. Honestly, we're still better than any other state that I've seen that has over 1 million people. Only Wyoming and Montana have numbers anywhere near our number, and they have almost no people there, really, like half our population. So we're doing fantastically. People are still, for the most part, really sacrificing, but the protests will yield some higher numbers in a week.
And Lieutenant Governor Green, I just wanted to ask you about this, these reports we also are hearing about vulnerable communities, like a high percentage of Filipinos and Native Hawaiians and Pacific Islanders being kind of the ones subjected to these infections. What's your insight here? Is it similar here in Hawaii as well, with the vulnerable communities being hit hard?
It is. Yeah, it's really mostly a structural problem, a living problem, where you have lots and lots of families living together in large properties and sharing multi-generational households. It's particularly prevalent in the Hawaiian community and the Filipino community, so you end up getting more spread that way. I'm not so sure that there's a genetic predisposition to getting sick or sicker from COVID because you're from one of those groups. That study, of course, has not been done yet, but I have been in touch with Pacific Islander community leaders all across the country, California, Nevada, Oregon, different parts, and they are seeing the same. So it's something we have to watch out. There's always health disparities, unfortunately, that hit our Hawaiian community worse. As you know, the Hawaiian community lives on average about 8 years less because they don't get as much access to healthcare. Well, this is along those same lines. They're getting hit harder because of lack of access to good services, testing, and prevention. So we have to be super mindful of that so we don't get extra fatalities.
And the other thing too is there's been some question about how the data is being released, just because we get these reports of these cases and then data cleaning, and because this number was incorrect from this number. So we are getting questions into our newsroom about how reliable is this data in the first place if we're constantly adjusting them. Can you say about that?
Yeah, it pisses me off when they have to add or subtract one, but in general, it's a trend. It's the trends that we're watching, and the trends don't lie. The numbers plus or minus 1 or 2, honestly, as long as it's not missing a fatality, is almost immaterial. But if we were seeing dozens of people taken off the rolls or added, then I would be very upset. Also, if we suddenly changed our protocols on the testing and so we had to change everything up, that would be bad. So I've been actually overall pretty satisfied with the data. It's still, remember, a sampling, because there may be a whole nother large number of people that never go for a test because they're minimally symptomatic. But this shows us exactly where we are in the hospitals, exactly how many people are severely ill. And that's another very good indicator of how we're doing. Yeah, we never test people in real rural areas. Like where I am right now, we almost never have anyone up here doing testing. So hard to know.
Yeah. And another question we get is just, do these numbers actually include military service members? Because that's a huge population here.
I'll defer to Department of Health on how they're reporting. I think they would be able to better answer the question. I don't want to give anybody a wrong answer.
Okay, I'll ask them, because I know that's another we've been getting questions about that, because it's not broken down from what we see.
Right.
So we'll
yes.
do that. Well, I just wanted to ask you in general, final statements or thoughts as we get into this new week, and as we, brace for more reopenings. A lot of people really relieved to see that. But again, if we see more numbers tick up because of these gatherings and these mass gatherings, we'll just be disappointed and erase all of the good work we've done.
We would, but I'm pretty confident we're going to be okay. So look at the 16th. The Gov made that order, and I'm confident it's fine. The 16th for inter-island travel, and I'm working feverishly to make sure that we get to a place where we can open up the state to the mainland with testing and safely. So putting a lot of extra effort into that, more than ever before, because now I know the reality of protests and how completely I guess just the demand from our people is that we do everything we can to, number one, keep everyone safe and healthy, and 2, open the economy, because our economy will die otherwise. So because of those 2 things, adding that layer of testing and lots of screening at the airport is necessary. So we'll get that done seamlessly for Peter, but I'll make sure we're safe.
All right, looks like you're going in and out now, but I'm glad we got you for the bulk of this conversation. Very important information, and to reassure us in this time of kind of uncertainty again. So Lieutenant Governor Josh Green, mahalo again for joining us. You can get back to work.
Thanks a lot. I'm going back in. See you soon.
Aloha.
Bye-bye. Aloha.